Hello everyone, my name is T.R. McManus, and today in this presentation we're going to be talking about how to explain regenerative cellular therapy, how to talk about regenerative medicine, what regenerative cellular therapy is, aka stem cell, and how to really explain it to people. And so hopefully this presentation gives you some more insight. I hope it makes it easier for you to understand it as well as be able to explain it to your current patients and potential patients that you might have. So let's just talk about the different types of regenerative medicine that we currently use, right? So we have regenerative cellular therapy, often referred to as stem cell, and of course we have platelet-rich plasma, often referred to as PRP. For today's presentation, we're going to be talking more about the stem cell or the regenerative cellular therapy. So first, let's talk about what different types of things we treat with the stem cells or with the RCT or the regenerative cellular therapy. Orthopedic applications, so bone, orthopedic usually refers to bone type stuff or joint, where we treat a lot of knee pain, hip pain, shoulder pain, plantar fasciitis, neck pain, back pain, all the different pains that a lot of patients present with. Cosmetic and aesthetic applications, so we're talking about wrinkle reductions, scar reductions, maybe different stains on the face, facelifts, breast lifts, as well as sexual health. So when we talk about sexual health, we're talking about sexual dysfunction in both men and women, as well as incontinence with many women. As they get older, they develop the inability to really kind of hold their bladder. So incontinence, and as well as hair restoration. So these are kind of how we use it, or the different types of things that we treat. The next thing is, let's talk about what is regenerative medicine. So regenerative medicine is basically a branch of healthcare research which regards to tissue engineering and molecular biology, and it deals with the process of replacing, engineering, or regenerating human cells, tissues, or organs to restore established normal function. So we always talk about it really being regenerative medicine, but when I look at it and we talk about it and we kind of explain it today, it really is just biology. It's really just the way that our body works, how it grows itself, how it maintains itself, how it heals itself, how it repairs itself. And so one of the ways to look at it is just basically biology. We're taking what we know works, meaning we know that babies are born, they grow their bodies, they have injuries and accidents along the way, and we know that their body has this unbelievable ability to not only grow itself, but maintain itself and to fix itself. And what regenerative medicine does is, it really, as our bodies get too far gone, or they're too injured, or they've gone through too much, it's able to use that same technology that we had used through our life and actually be able to give enough power back to the body to be able to do what it knew how to do, which was to fix itself. So that's kind of what regenerative medicine really is. It's kind of just basic biology. So let's talk about what are stem cells. So stem cells are basically cells that are undifferentiated, meaning they are not determined what are they going to be. Are they going to be a joint cell? Are they going to be a cartilage cell? Are they going to be a cell in the organ or muscle? And they are still neutral. So they just basically haven't chosen what they can become or what they will become. And of course, doctors or providers are able to actually take these cells and help patients, have the patient's bodies get help to actually repair any damaged or diseased tissues that somebody might have. Now, the kind of stem cells that we want to talk about are the mesenchymal stem cells, or sometimes people refer to them as mesenchymal stem cells, and they're very often called MSCs. So MSCs, or mesenchymal stem cells, are a type of an adult stem cell. That's an important distinction, because there's going to be a lot of patients that you talk to, or potential new patients, that they're kind of still involved in stem cell 101 or 1.0, and that's when, a couple decades ago, people started to look at options on how we could use stem cells to fix certain conditions. And they tried with other types of stem cells, not mesenchymal stem cells or mesenchymal stem cells, other types of stem cells that may have been not adult stems, and things like embryonic stem cells, right? So these were cells that are completely different. They are the stem cells that you get from embryos or not adult stem cells actually have an ability to become more different types of tissue. So with mesenchymal stem cells, they're what's called multipotent, meaning they can turn into several different types of tissue, which we'll talk about, whereas the other cells, or the embryonic cells, are more like pluripotent, and they can become more cells, so they can become teeth cells. They're designed to try to grow this body entirely. The other thing with them is they were found to maybe grow tumors, And they were also found that the body would notice when they were put in. These are not the mesenchymal stem cells, but the other ones were noticed by the body, or they are the immune system of the body, and it would try to attack it. So in early stem cell treatments, there was some scientific problems, and there was also some ethical problems, since they were taking these things from embryos or different fetuses and different things that we have all kind of heard about, and some patients still think that we're there. So a pluripotent stem cell, or something from like an embryo, is able to turn into just about any type of cell. So, and put into the body will notice it. And so from the medical side, they would have, and the body would attack it because they'd consider it a foreign invader. So they'd have to lower people's immune systems, right? They'd have to give drugs to lower the immune system so it would take the treatment, and sometimes the body would still reject it. But the other problem was there was no way to control it and what it might try to grow. So different tumors could get formed, different things could get done, and you would never know really what was going to actually happen. So those are not the type of stem cells we use. Remember, we're here talking about mesenchymal stem cells, or MSCs. They are multipotent, meaning they can only turn into several different types of tissue, and this is a type of tissue that we're looking for it to turn into: ligaments, cartilage, muscles, etc. And they're non-tumorigenic, meaning they do not turn into tumors. The other cool thing about these mesenchymal stem cells is they're immunoprivileged, or basically your body, they produce this molecule that basically hides them from your immune system, so your immune system doesn't attack it. And they're allowed, studies have shown they've been allowed to actually continue working in the body for between up to 4 to 8 months. So imagine that when we put these mesenchymal stem cells into somebody, they're going to be working every second of every minute of every hour of every day, trying to help fix somebody for up to 4 to 8 hours. And after, up to 4 to 8 months. Now, once they actually stop producing this molecule that kind of hides them, the T cells, or our immune system, will notice them, and they just kind of surround them and they get them out of the body. So mesenchymal stem cells, the good thing about them is there's no ethical reasons. We get them from a planned C-section. The mother is screened, the mother is tested. After the birth, the baby is actually, it's a live birth. The baby is removed from the whole thing. They have the umbilical cord, and we get these mesenchymal stem cells from the Wharton's jelly of the umbilical cord. And there's two sides, of course, to an umbilical cord: the side where the mother is and the side where the babies are. What they have found is that the side nearest the baby is actually very rich in these mesenchymal stem cells, and they process them, they check them, they send them out for independent testing, and then they're shown that there's no problems with them, and they have no diseases, and nothing's going to get passed to the recipient. So the mesenchymal stem cells we get from umbilical cord tissue, specifically the Wharton's jelly of that tissue. It's from a live planned birth. They get tested to make sure that they're completely safe to be given to somebody else. They're then frozen, and when your doctor, or when you order them, they're sent to you guys, and then they get transplanted, or basically injected into somebody else. They're non-tumorigenic. They do not form tumors. There's nothing. They're an adult stem cell, so it's from post-birth. There's no babies harmed in this whole thing, and the immune system allows them to stay in there and actually do the work. Now let's talk about what kind of work that they do. So there's 4 major things that they do. Of course, they do a lot of other stuff, but let's look at the 4 big things that mesenchymal stem cells are kind of famous for. 1, they help reduce inflammation. So they lower inflammation in the body. Well, inflammation, as we know, is not a good thing. Inflammation would be on the degeneration side of things. And with that, with the inflammation, lowering the inflammation, a lot of times you have a reduction in pain. Inflammation is known to really cause pain. Inflammation has also been found to cause other problems like autoimmune stuff, Parkinson's, Alzheimer's, cancer, and a lot of even depression. There's a lot of bad stuff that inflammation does. So lowering inflammation is a really important part of the body. And a lot of time with the patients that we're treating, the reduction of inflammation is going to really help lower their pain. The next thing they do is they help modulate the immune system. What does that mean? Well, a lot of people don't realize that the immune system plays a pretty active and important role in actually not just preventing you to get a cold or pneumonia or a virus or a flu. They actually also has an important role to play in keeping your body going and repairing and being okay. So what happens when your immune system is too low? You become susceptible, of course, to different diseases and different viruses, etc. The other times when your immune system is too high, a lot of times that can be the onset of some autoimmune disease where your immune system is actually attacking your body. It's overactive. So these mesenchymal stem cells actually go into the body and they actually tell it, hey, calm down, or hey, speed up, and they help modulate it, or they help the immune system have the right response. The next thing they help do is they help reduce scarring. They help reduce scar tissue. So they have the ability to actually, when sometimes when we're injured, the body will lay down scar tissue, and it can actually prevent the proper healing or letting the body return to normal function. So they can actually help with fibrosis or reducing scarring. And the next thing they do, which is a big important thing, is they help your body regenerate. And that's an important distinction. They help your body regenerate. Most people think that these mesenchymal stem cells get put into somebody's knee and they go to work and they build more cartilage, or they build more this or build more that. They actually go in there and they give the resident cells and the resident properties, the healing properties in your body, they go in there and they aid them, and those resident properties, or the resident stem cells, etc., they activate them and they get them to go and actually turn in and grow the new cartilage or do whatever repairs that are necessary. They also help keep the status quo in your body, and this is a super important part. They actually help maintain your life, and what I'm talking about is they actually help keep your body going and maintaining itself, or keep the status quo. One of the things I read in one of the books was this great analogy about when we're born, we have a certain allotment, or we get a certain inheritance of these mesenchymal stem cells. And you could look at this inheritance as your bank account. And so we're born, we're a little baby, we have a certain number of these regenerative properties, and specifically these mesenchymal stem cells. When we're born, we have about one of these mesenchymal stem cells for every 10,000 cells in our body. So we have one of these, for every 10,000 cells, we have one of these mesenchymal stem cells. Remember, they're for lowering inflammation, they're for modulating the immune system, for reducing scarring, and they're for helping repair, getting your body to repair itself, and they're also for helping keep the status quo. Now, so we're born, we have this certain inheritance, we have about one of these stem cells for every 10,000 cells, right? Now, the other thing that's unique about these stem cells is that when we're born, they have what's called a proliferation time, or a doubling time. So one can become two in about 20 to 24 hours. And I don't know if you've ever heard of the whole analogy. Would you rather have $200,000 cash given you today, or a penny that doubles every day for 30 days or 31 days? And most people go, if they don't know or never heard this, it's called compounding interest. They're like, oh, give me the 200,000 bucks. But what they don't realize is a penny that will double every day for 30 days or 31 days becomes millions of dollars. It starts out slow. One becomes two, two becomes four, four become eight. But towards the last couple of days, it goes like 200,000, 400,000, 800,000, 1.6 million, 3.2 million, 6.4 million. So this doubling time, this compounding interest really starts to grow. And with these mesenchymal stem cells, it works the same way. So if you have one of these mesenchymal stem cells and it takes 20 to 24 hours to actually double or become another cell, at the end of 30 days, it's more than 1 billion cells. So more than 1 billion cells in 30 days. One becomes 1 billion in 30 days. Now, what happens remember, we have our inheritance. We get so many of them, and we start to use them, and we also lose them. So how do we use them and how do we lose them? Well, we have accidents, slip and falls. If you think about over the course of your life, how many times you've had an accident, an injury, a slip, a fall, bumped into a table with, a nightstand or whatever, and gave yourself a little bruise, your body had to actually repair it. When it has to repair something, remember, it has to go and dip into this bank account, and it has to actually pull from it, and it uses them up. The other thing that happens when we're born is we're small, and we have to grow our entire bodies from being small all the way to being full grown. It's called, when we reach our skeletal maturity around our early 20s, late teens, early 20s, the crazy thing is we've used up. So to grow our bodies takes a lot of effort. to grow our bodies, and when we reach our skeletal maturity, we have and we use about 90% of our inheritance, or 90% out of that bank account, right? Think about it. Every single day we're getting little bumps, little bruises, little injuries. And we use them up. Every single day when we're young and we're learning to walk and this stuff is happening, not only are we having these falls and these little things that happen, but we're also growing that body. By the time we reach our skeletal maturity, once again, we have used 90% of our inheritance. We've withdrawn 90% of our funds. We have to live the remaining years of our life from our late teens or early 20s off the remaining balance, or the remaining 10%. So what happens? We use them through accidents, injuries, slips, and falls. We use them to grow our body. And we also remember the fourth thing that they do is they help maintain the status quo. They help actually keep producing and they tries to keep your body exactly like it is. Now, what happens is when we're born, we have two factors. There's basically like a battle that starts, or a war that starts. And this battle is between regeneration, and this battle is between degeneration. So we're born, we come out, and guess what? Cells start to die. It's like 15 million cells every 5 minutes, like blood cells in your body, die and have to be replaced. So that's the degeneration forces, right? And then we have this big inheritance of all these regenerative properties that we have in our body, including these mesenchymal stem cells. And we have this huge inheritance, no big deal. We have this huge army of regenerative properties that can overcome degeneration, right? So as cells start to die, no big deal. We can invest, or we can spend a little more money. We can send more troops into the battle, and we can overcome the degenerative forces. Now, as that happens, and we start to, over time, continue to use them, we, of course, lose them and we use them. And by the time we get to be older, what usually happens is we've lost and used so many of our troops, so many of these regenerative properties. It's hard to do this battle, right? So as we get older, there's two other issues that happen with these regenerative properties. So we're born, we have a certain number of them. They actually get slower. Now remember, I told you when we're born, we have about one of these cells can double every 20 to 24 hours. So in 1 month, we can get 1 billion of these cells. As we get older, the cells, just like our bodies slow down, these cells start to slow down. So what happens is when we're age 65, it takes about 60 hours for one of these cells to proliferate, or to double and become another cell. So as that happens, it takes 60 hours. So they're basically, it seems like they're 2 or 3 times slower, right? But really, that 60 hours, if you have something that doubles every 60 hours for 30 days, it's only 200 cells. It's only 200 cells at the end of the month. So when it's every 20 hours, it produces 1 billion. When it's every 60 hours, it produces only 200. So now we don't have that many of our forces left to fight this battle, regeneration versus degeneration. And to get more soldiers, instead of getting 1 billion a month, we only get 200. Makes sense? So we have another problem here. Now, another problem is supplies. So in any kind of battle, you have to get resupplies, right? Well, when we're born, these cells are able to produce hundreds of different types of proteins, hundreds of different types of different types of cytokines, collagen, fibrogen, growth factors. These cells are able to produce hundreds of different things that actually help our supply the whole regenerative process. Now, when we get into our 50s, it could be 100 or less. So when we look at this whole battle between regeneration and degeneration, there's several problems. One, we use most of our forces up by our early 20s or late teens. The second thing is they start to slow down. So we have less, they slow down and they don't produce as many as they could. And the other thing is they don't produce as much regenerative properties to actually help the body to regrow itself. Now, when you look at, when I told you we use a lot of them up and we don't have that many left, I told you before we have about one of these stem cells for every 10,000 cells. When we get to be age 50, we have about one of these stem cells for every 400,000 cells. So when I tell you we use them and we lose them, it's true. So if stem cells are there to help reduce inflammation, if they're there to help modulate the immune system, reduce scarring, and help regeneration, fix things and help keep the status quo, help maintain life. Instead of having one for every 10,000 at age 50, we have one for every 400,000. The bad news is we now have 40 times less of the properties than we had before to fight this battle versus, regeneration versus degeneration. When we get to be 80, we have one of these mesenchymal stem cells for every 2 million cells on average in our bodies, which means we basically have 200 less times the property believe that the future of healthcare and the future of medicine is going to be regenerative medicine. And if you look, and it's a really cool part of healthcare to be in. It's natural. It helps prevent drugs. It helps prevent surgery, but it also helps give people back their life, meaning get them out of pain, helping the body return to function, and that's what they're looking for. They're looking to be able to get out of pain so they're not suffering, and they're looking to be able to get back to using their body so that they can do the things that they love to do, enjoy their family, enjoy their friends, enjoy their pastimes, play golf, work. So we're in a very cool sector of healthcare. I want you to really go through this a couple times. There's other things that you could read, there's things that you can watch, but becoming an expert at explaining this in a way where patients understand it is going to be an important part of getting patients to go, hey, this is something that I should invest my resources in, which we know are their time, their energy, and their money, because this is the thing that will prevent the drugs that they have to take to not have to deal with the pain and prevent surgery, and it will prevent them from getting worse. So take the time to go through this a couple times. Take the time to actually learn this kind of stuff. And I look forward to hearing from you when I see you at seminars. And if you have questions, make sure that you please reach out and call me. Thanks for your time. I hope you enjoyed this presentation.